Good morning and welcome to Arkansas Children's. I'm Rebecca Brockman, and this morning I'm joined by Dr. Rebecca Cantu, and we are going to be talking about an infographic. I'm sure you've seen it on our social media channels, cold, flu, or COVID-19. And I think especially now, more than ever, you're curious about the symptoms and what exactly you have or maybe your child has. So we're going to break that down today. But first, Dr. Cantu, let's talk about how in October you were encouraging everyone to get a flu shot. It's now mid-December. Is it still okay to get the flu shot now?
Yes, absolutely. If you have not gotten the flu shot yet, it is not too late. You should get it as soon as possible. It does take a couple weeks for your full immunity to kick in, but flu season typically lasts well into March. So there's plenty of time where you can still catch the flu, and so you should still get your flu shot now.
Excellent. And Arkansas Children's is going to be having a drive-through flu shot this Saturday from 1 to 4. So if your child is a patient at Arkansas Children's, please come by and sign up. We'll have some more information down in the comments below, but that is this Saturday. So let's talk about this infographic. We have cold, flu, and COVID. Talk about some of the symptoms and if they can be similar.
Sure. And I'll mention quickly, I've been seeing patients, so just as an extra precaution, I'm keeping a mask on today since I've been around a lot of sick people. But as you can see from this infographic, there's a lot of overlap in these different illnesses. They can all have some very common symptoms like fever, headache, coughing. And so the big thing is if you're having any symptoms of being sick, whether you think it's the cold or flu or COVID, you need to stay home. Keep a mask on, stay home from school and work, and isolate yourself from people that you may pass any of these illnesses along to, because they can all be very bad for certain people. You should talk to your doctor about what to do, about whether they think you need to be tested for any or all of these illnesses.
Excellent. So along those lines, if they are having maybe a cough or a fever, how long should they stay at home and when should they see a doctor?
So it can vary depending on whether or not you've been exposed to COVID. So if you have a cough and someone in your home is positive for COVID, you may have a longer quarantine than if there was nobody close to you. So it can vary a little bit, and so I'd recommend keeping in close contact with your doctor. The CDC also puts out guidelines which have changed a little bit recently, but typically you can expect from 10 to 14 days that you'll need to be isolated.
Okay. And what is the best way to treat, if it is a cold and flu, to treat at home this type of season?
Good question. So most of these in normal, healthy people can be treated symptomatically at home. For the cold, there's nothing we can really do to make it go away faster. So resting, staying well hydrated, you can use things for your fever if you're having a fever or aches. For the flu, some people will qualify for something called Tamiflu, but that's typically up to your doctor. Not everybody needs to take that. And so the same things apply. Getting a lot of rest, staying away from people, plenty of hydration, and just taking care of any symptoms like fevers or achiness.
Okay, and if you have any questions for Dr. Cantu about the cold, flu, or COVID-19, please leave them below and we'll make sure to get them addressed. And something I've seen a lot on social media and just media, is it possible to get the flu and COVID-19 at the same time?
Absolutely. You can really get all of the above at the same time, unfortunately. And if you have flu and COVID at the same time, it's very likely to be more severe than either one alone. That's why it's so important to get your flu shot and try to avoid getting the flu, and just keep your mask on, stay isolated, stay home if you're sick, don't gather over the holidays. This is the time to just batten down the hatches and stay away.
Okay, I know it's hard to imagine having one alone, but having them both.
Yes.
So you want to avoid that. We want to talk about getting tested for the flu and COVID. I know there are some clinics that do it at the same time, but what are we doing here at Children's?
Currently right here, we'll have one or the other in the drive-through clinic. So if you have symptoms, that's why you should talk to your doctor first, and they can help decide what you needed to be tested for and what's the best way to go about doing that.
Okay, so definitely the main theme is talk to your doctor, make sure you've got some good communication so you know what to do and how to get better faster. Let's talk about some of the common misconceptions out there about cold, flu, and COVID.
Mm-hmm.
What's some of the common misconceptions?
So I think one of the biggest one is that people think either they can't get it, like the flu or COVID. They say, well, I never get the flu, or I'm not exposed to COVID. And the thing is, you just don't know. With COVID especially, we see the pre-symptomatic days, so the few days leading up to someone getting symptoms are when they're most contagious. So someone might not know they have COVID-19 and be exposing you to very high levels of the virus. Same with the flu. Just because you've never gotten it before does not mean you won't get it this year. And so the best thing you can do for all of these is, again, good hand washing, keep your mask on, and stay home if you're sick to avoid spreading it.
And you did talk about this a little bit. We're headed into the holidays. We're just a couple weeks out from Christmas and colder months. How can people stay healthy?
So to keep repeating myself, get your flu shot, wash your hands, wear your mask. It's very important. I know it's hard to avoid our big holiday gatherings, but we've been seeing a lot of spread from families getting together who don't normally live together. So this is the year you can have a Zoom holiday, try to make some new traditions, have a nice, small, quiet at-home celebration. And hopefully next year when we're able to gather, that means everybody will be there with us healthy.
Excellent. Dr. Cantu, thank you for your time this morning. Thank you for watching. As a reminder, we will have a drive-through flu shot clinic this Saturday for Arkansas Children's patients in Little Rock from 1 to 4. We'll make sure to put the details below. But in the meantime, just keep washing your hands, wear your mask, social distance when you can, and stay healthy. So thanks for watching. We'll see you next time.